Residents of Kilifi are benefiting from the distribution of nets as the county and the country strives to lower cases of malaria.
The mass distribution exercise targets areas where malaria is endemic and will see over 15 million nets distributed in 22 counties.
That's right. Now, the last mile distribution was one of the programs that had been flagged as a suspect in the procurement of the Ministry of Health's kemsa. Let's get more from our very own Brenda Wanga.
Mariakani Sub-County Hospital has been home to Lima Katana and her 2-year-old daughter for close to a week. They were referred here from their home village when the toddler was in the throes of pain and agony. For the second time in as many years, this little girl was battling a disease that continues to be a major public health problem in Kenya, malaria.
Jumaa alitoka shule vizuri, Jumamosi akashinda vizuri, ilipofika kama mida ya saa 9 ndo akaanza mwili moto tayari. Babake akaja akamchukua, akaenda naye akampeleka hospitali. Alivyomrudisha sasa Jumatatu jioni, tunataka kulala, ndo mtoto akaanza tena hali mbaya zaidi, akawa mwili uko moto, yuarusha mkono na mguu, pia meno ameyafunga na ukimuita hataki kuitikia na angalie mtu. Tukabidi tuondoke nyumbani Ribe mpaka Holland.
Lima and her family reside in one of the malaria hotspots in Kilifi County. When it rains, malaria cases become near normal here.
Twalala ndani ya neti, lakini mahali tunaishi kuna ng'ombe, pia maji. Hali kama hiyo ndio naona ilimuaffect mtoto wangu. Maana pengine kule kucheza karibu na zile ng'ombe, karibu na maji machafu, hivyo pengine inaweza kuwa mwenyewe unafaa ujue mtoto yuko wapi, kumbe ameenda chezea maji machafu. Ukimuita ukija hoteli matope, utambadilisha sasa ujue unaona tu ni hali ya mtoto. Ndo baada ya hapo ndo mwanangu akaanza kuugua sasa.
Some kilometers away, in Bundache village, the malaria burden is equally high. Healthcare workers contend that a good portion of the population here has at one time or another suffered from bouts of malaria.
Out of 10, around 4 or 5, we diagnose them with malaria. So that is the trend. The prevalence has been quite high, yeah. But it declines once we put the measures like mass net distribution.
The prevalence is more than 5%. In my sub-county, I have hotspots areas. I have 2 wards that are prone to malaria, and that is Kaloleni and Mwanamwinga wards. So these are prone to malaria in terms of the geographical area because there are streams that pass through these 2 wards.
Malaria remains a public health challenge in the country. The country's altitude, temperatures and rainfall patterns have all been known to contribute to the prevalence of the disease that threatens at least 75% of the country's population at different times of the year.
Kwa hivyo tukiangalia kama miezi miwili nyuma kwa sababu ya hizi mvua tulikuwa tumeanza kuadmit severe malaria kwa ward zetu. So utapata kwa mwezi kuko na kama 2-3 ambao wanakuwa admitted kwa sababu ya severe malaria. Na ukiangalia hao wenye wamekuwa admitted sana wanatoka hizi the hotspot areas na some parts of Kwale.
To mitigate this and reduce cases of the disease, the government has over the years implemented strategies aimed at preventing the spread of the disease as well as managing those who already get sick. One of the long-term methods employed by the government is the distribution and use of long-lasting insecticide-treated nets to communities in malaria endemic zones. This year alone, the government aimed to distribute 15 million nets to 22 malaria endemic counties to benefit at least 27 million people. Kilifi County is one of those counties targeted for the distribution of the nets. Former KEMSA board Andrew Mulo explains why Kilifi was chosen as one of the counties for this.
Malaria is one of the leading causes of morbidity and mortality in the country. Despite a lot of efforts that have been made to roll back malaria, kick out malaria in the last 20 or so years, malaria still contributes a lot of illnesses in these 18 counties.
The last mile delivery of the nets by the government agency KEMSA started in January this year, a few months after the program, supported by the Global Fund, ran into headwinds following a scandal involving the procurement of the products that saw the sponsors cancel the process and take it online.
I think for us as KEMSA, we actually made a lemonade out of it, because whereas we did not proceed with the procurement was done by Global Fund through their global systems. We were able to get the confidence of Global Fund to do this last mile distribution. What Global Fund did is they supported us they agreed to us to be their agent for last mile distribution, paying as a facilitator of paying for all these activities that we are doing in terms of logistics of transport, logistics of registration, logistics of last mile distribution.
The county of Kilifi is distributing over 1 million nets to families at risk of getting malaria. The last time this region and others benefited from the mass mosquito net distribution was 3 years ago, and the efficacy of those nets has declined, a situation that had left residents here exposed to the vulnerability of malaria infections. Residents of this county are now hopeful that sleeping in the insecticide-treated nets will go a long way in reducing the instances of malaria here and free them from spending time and money seeking treatment.
Malaria, tukiangalia malaria inaweza sababisha mauti, malaria inaweza sababisha complications kwa organs zetu, na wakati tukipata interventions ambazo zinaweza kumaliza hizi malaria kabisa, inakuwa ni afueni sana kwa community.
Instead, they now say they're looking forward to using that saved time to be economically productive and lift their communities from the high poverty levels. Brenda Wanga, Citizen TV.